Headache is a condition when a person experiences pain in the head area. Headache is presumed to be caused by stress, lack of sleep, hunger, or tension at work. Since headache commonly occurs once or twice in a month and gets relieved on its own, people take it as a normal part of their busy lives. This may be true for primary headaches, which involve the physical structures of the head, but otherwise it can mean something else. In reality, a secondary headache is one of the most common symptoms of many diseases. A primary headache is a headache that is caused by the hyperactivity or problems in the pain-sensitive structure in the person's head. The examples are tension, migraine, and cluster headache. Tension headache occurs due to the stiffening of the muscles surrounding the head, like the neck or scalp. Its pain is pressing or tightening, cause you to feel discomfort or heaviness in the head, like a tight band is wrapped around your head. It is the least severe from all the primary headaches, but the most common one. Its incidences range from 10 times a year in infrequent cases to 180 times a year in chronic cases. Migraine is famously known as a one-sided headache and is more severe than a tension headache. It may start to develop at a young age. Migraine headache is throbbing in character. It feels like somebody is smacking your head with a hammer. The headache starts slowly, intensify with 1 to 2 hours, last continuously for 4 to 72 hours, and then disappear. Along with the headaches, some people also experience nausea and vomiting. They also get irritated with noise and light, so they prefer a dark, silent room. About 15 to 30% of people experience migraine with aura or classic migraine, when they experience vision disturbance, such as flashes of light, distorted image, before the headache strikes. Cluster headache is one of the most painful types of headache. You will feel intense pain inside or around one eye or one side of your head. It is so severe that it can wake you up in the middle of the night. It is called cluster because it happens in cluster periods, when the attack happens between weeks to months. Then, the remission periods come and the headache is like poof and gone for months, sometimes even years. Fortunately, it is rare and is not threatening to our life. The frequency of primary headaches increases in special circumstances, such as tests or examinations. Some females experience migraine during their periods. We call it catamenial migraine. Too much sleep, not enough sleep, sun exposure, and processed food that contain nitrates also can trigger primary headaches, depending on each person. An MRI or CT scan of the brain will give a normal result. However, primary headaches are still painful and can prevent us from doing our job efficiently. Sleeping or taking painkillers such as paracetamol will help to subside the pain for a short term. For a longer term, it is suggested for people that often have a headache to establish a healthy lifestyle, which includes 15 minutes of exercise every day, enough hydration, a healthy diet, and regular sleep habits to help avoid the headache. Only 1% of people who have headaches that are symptoms of dangerous or life-threatening diseases. There are 4 alarming signs that one should remember to differ between primary and secondary headache. First, if someone is having a new headache after the age of 50 without experiencing such a headache in his life before. Second, the headache is very severe. It is so severe that one labels it as the worst headache of his life. Third, the headache is associated with some other symptoms, like weakness or numbness. For example, one side of the body has become weak or paralyzed along with the headache. Fourth, if someone becomes unconscious or experiences an epileptic fit along with the headache. If someone has any of these 4 alarming signs with their headache, they should be properly investigated. CT scan or MRI of the brain, along with other testing like lumbar puncture or draining fluid from the lower spine area, are required to determine the proper diagnosis of the disease. We need to understand that although headache is common, can be treated and controlled, it is not a normal part of our daily lives. When you have a recurring headache, try to take note of the pattern. Ask your family members about their medical records. After that, consult with your doctor so he can judge accordingly and give the best treatment for your headache. And make sure we can continue our job with minimum disturbance.